Thank you, Mr. Chairman, and thank you all for being here today. If I may, I'm going to go back to something I was touched on briefly the last time that we met, and that's what we actually spend for the care that's delivered. And I had asked about knowing the number of how many RVUs per year does the VA generate with their caregivers, the relative value units. And that's a common term used both in private sector and in the VA. And then what the total cost is. And then by total cost, I don't mean just what the doctor's getting paid, but everything, administration, physical plant. And it sounded like Mr. Gibson said, oh, we're a long way from coming up with that number. And my question is, how do you come up with a budget if you can't say what that number is today? So how much did we spend on everything to do with healthcare per RVU that was generated? And so I'm curious why we can't come up with that number, for one. Because I wonder sometimes when we look at choice, are we really determining, is it more cost effective and of patient benefit in some regions to refer out rather than build out? You know, and because the cost per RVU to the outside doc is pretty easily defined. You know what you paid that doctor. But that doctor is then paying for their physical plant and their staff and their malpractice and all those other expenditures. So that's pretty well defined. But we're not being realistic if we don't look at the overall picture of what we're spending per RVU. So if you could comment to those issues.
Well, as Sloan said, that's a system we have to develop. We're in the process of doing that. It's not perfected yet. The numbers aren't as valuable yet. The department has had a history of working to a budget. It's not worked to a demand or to a customer focus. As a result of that, Congress would provide a budget, and that's what the department would work toward. That budget would be allocated throughout the department. So we're actually, contrary to what Congressman Kaufman thinks, we're actually making some relatively large changes here to focus the organization on the customer and to be able to get that data. Dr. Clancy can talk about the process of doing that, but this is a big undertaking.
So if we know what the budget is for all the health administration costs and what that is, can't that give us something to start with? In other words, I feel like we need a baseline. We can start to look at that more closely at different facilities as we I'm looking down the road, you know. I'm here for the same reason I think you are, is to make a difference and to make good decisions. But we've got to come up with those numbers because you can't decide if choice is working better or worse and effectively, especially when it comes to the dollars. Yeah.
Thank you. That's part of the independent assessments that we will be getting as well. One of the wild cards here that I'm sure you're quite familiar with in terms of comparing how efficient and productive we are, cost per RVU versus a private sector, is that there's a big difference in terms of fixed costs versus variable costs. If you've got a building where you have to keep a cafeteria running and all that kind of stuff, that's the point that was in the overall opening statement from Secretary McDonald. In the private sector, they've got a lot more flexibility, but we will be looking at that very, very hard because as we look to a future where, as Secretary McDonald said a few minutes ago, it's going to be both about what we provide in VA as well as what we send out to community partners through non-VA or fee care and choice and so forth, or something like it, possibly with a different name. We've got to be very, very smart and as strategic as possible about make or buy decisions. And
well, I look forward to seeing those types of numbers because that's got to be our guide as we try to decide what's best for the veteran and the VA itself as we go down the road.
Absolutely. And those answers are probably going to be different in some communities than in others, depending on local capacity and so forth.
No, I think you do have to evaluate locally, but you can start with what it is in the big picture and then take a look locally because every place is going to have a little different demand based on VA population, et cetera. So I look forward to working with you on that, and thank you. I yield back.